Warahmatullahi wabarakatuh. This is one of the most common scenarios with reference to obstetric anesthesia. So we have a patient who has a history of placenta previa, type 4 in last pregnancy, having massive bleeding. So now this patient is having another pregnancy. So there will be chances of another placenta previa or even further invasion in the form of placenta accreta, increta or percreta. So how will you be evaluating the patient? So ultrasound or MRI may be needed to diagnose presence of any invasive placenta, and then you will be evaluating the patient not only in addition to the routine preoperative assessment which we do for any patient coming for anesthesia with reference to any comorbidities and overall systemic analysis, any decompensation, any optimization to be done, but not only specifically here, any coagulation problem and any anemia. So you will be treating baseline status, hematological status, and any other comorbidity or any even full history which is there with that patient. Then there will be a lot of preoperative work with reference not only to the preparation of operation room but also involvement of the other subspecialties like interventional radiology, hematology, blood bank, neonatology, ICU, and according to if there is invasive placenta like increta or percreta, so then maybe the involvement of urologist, general surgeon, and interventional radiologist can place a intravascular like embolization balloon. Okay. And then in perioperative period, not only you will have blood and blood products, but you will be arranging all the maneuvers which can decrease the bleeding in the form of or manage massive transfusion. So not only the large or IV bore cannulas, intra-arterial blood pressure monitoring, cell saver, provision of thromboelastography or ROTAM, INR, and then any point of care testing with reference to monitoring the patient like in ABGs. So things like that you will be needing. In addition to that, and there will be a big role of cell saver, which has some limitation in the form of amniotic fluid, and this will only be giving the cell, the RBCs, not the other coagulation factors or platelets. So these will be the limitations of placenta. So like these things we will be thinking. And with reference to pharmacological, not only the oxytocin or ergot or misoprostol or PGF2 alpha, but with reference to massive blood loss and nothing is working, so you might need Novo 7. Okay. Surgical techniques which will be needed, not only the uterine massage or packing or this B-Lynch or B-Lynch suture or Bakri balloon. There is a balloon which is placed vaginally to reduce the bleeding. And last but not least will be the hysterectomy. So these things you will be doing. And then with the reference to the conduct of anesthesia, of course, if you have any doubt if it is diagnosed and properly placenta type 1 or 2, you can have central neuraxial block, but otherwise it will not be a wise idea to give regional anesthesia. Yes, epidural anesthesia you can use for post-operative analgesia, but you will be anticipating bleeding. So this will be our decision risk versus benefit. Otherwise, if it's a hemodynamically stable patient, you can go with the normal induction. Yes, you will have all the anatomical, physiological, and pharmacological consideration which will be there in any pregnant patient with reference to difficult airway, chances of aspiration, difficult intubation, difficult mask ventilation, easy desaturation, hypercoagulability, 2 lives. Proper monitoring of the patient, avoiding any factor which reduce the uterine blood flow till the time baby is out, and of course you will be ruling out any other hemorrhage, sorry, obstetric emergency. So this is just an idea in the way you will be answering this question. I've tried to be in 5 minutes, because in the oral part you usually have 5 minutes, but for practice, was for understanding, you need to know about cell saver, you need to know about complications of massive blood transfusion, you should be knowing all the maneuvers you should be doing for any massive bleeding, you should be knowing what is Novo 7, you should be knowing what is the individual effects of all uterine tonics. Cell saver I have already discussed. They can ask you in this question even about cell saver. They can ask you about what is placenta previa type 1, 2, 3, 4, what is increta per creta. That's it. Thank you very much.